Hi, hello everyone. Today let us start the new topic. Which of the following is the best initial test for evaluating a suspected ectopic pregnancy? First of all, do you people have any idea about this ectopic pregnancy? So, ectopic pregnancy means what? If the pregnancy occurs elsewhere in the other than the uterine cavity, anywhere the ovum is going to implant other than the uterine cavity, except the uterine cavity. If the fertilized ovum got implanted in any other part of the body, that is known as ectopic pregnancy. So most of the time this ectopic pregnancy mostly observed in the tube, so it is also called as tubal pregnancy. So here what they asked us, what is the initial test in order to evaluate this suspected ectopic pregnancy? First one, transabdominal ultrasound. Option B, serum beta HCG levels. Option C, pelvic MRI. And option D, diagnostic laparoscopy. In case of ectopic pregnancy, if we go through the transabdominal ultrasound, what we'll identify? We'll identify the gestational sac at the age of 5 to 6 weeks. If the ovum, whatever is implanted, if the sac age is about 5 to 6 weeks, we can identify through the transabdominal ultrasound. Here, the beta HCG levels also at the intrauterine gestational sac, which is seen by this transabdominal ultrasound, will be 1800 international units per liter. So, the transabdominal ultrasound is the most preferable test in order to identify this suspected ectopic pregnancy. So, option A is the correct answer. Beta HCG levels also represent the case of ectopic pregnancy. But in this condition, what happens? This beta HCG levels also can be represented to show the pregnancy, but wherever it is located and what is the extension, we can't identify through this beta HCG levels. Pelvic MRI and diagnostic laparoscopy is not at all indication of this test. So, ectopic pregnancy means, what is the definition of ectopic pregnancy? If the fertilized ovum is going to be implanted or develops in the site other than the uterine cavity. Other than the uterine cavity, the fertilized ovum will be implanted any other place, that is known as ectopic pregnancy. So what are the sites of implantation? What are the main sites which can be identified in this condition? It is mainly classified into extrauterine and the uterine. In case of uterine means the pregnancy may develop in the cervical region or angular, caesarean or the cornual region. But in case of extrauterine, where we can identify this means most of the time it may be tubal. Means in case of fallopian tube we can identify, or if the ovary itself may be the reason for ectopic pregnancy, and abdominal. Abdominal also it is mainly subdivided into primary and the secondary. In case of secondary it may be intraperitoneal or the extraperitoneal. Means inside the peritoneal cavity we can identify, or extraperitoneal cavity means outside the peritoneum. Especially in case of broad ligament we can identify this extraperitoneal pregnancy. So if the pregnancy we can identify in the fallopian tube, it is mostly 96%. So in the beginning itself we had seen that this tubal pregnancy also represent as a ectopic pregnancy or tubal pregnancy. So in case of ampulla, most of the time we identify this ampullary part pregnancy, that is mostly about 70%, and very less it is seen in the infundibulum, that is only 2%, and the other regions include interstitial and isthmus, that may be about 18% and the 25%. So in case of tubal pregnancy we can identify in these four regions, and in these four, ampullary, infundibulum, interstitial and isthmus, mostly we can be identified in the ampullary region, that is about 70% ectopic pregnancies will be observed in the ampullary region. So what are all the clinical manifestations we can see in this ectopic pregnancy? It is mainly identified as a classical triad. The triad includes pain, amenorrhea and the vaginal bleeding. If the patient is having the severe pain, and based on the nature, it will be different from person to person. And if the person is having amenorrhea may be delayed or slight, very slight spot may be observed at the time of menses. So the person may be expecting as a menses. And vaginal bleeding also, it represents like scanty dark brown. The vaginal bleeding will be dark brown color. What are all the diagnostic findings in order to evaluate this ectopic pregnancy? Mainly transvaginal sonography. It is the most sensitive test in order to identify this ectopic pregnancy. Here, if the intrauterine gestational sac is about 4 to 5 weeks and the beta HCG levels will be observed as low as the 1500 international units in case of this transvaginal sonography. TVS means transvaginal sonography. So if the intrauterine gestational sac is 4 to 5 weeks means we can identify through this transvaginal sonography. Whereas through the vagina we can identify this. Transabdominal ultrasound will be here the gestational sac, if the growth is about 5 to 6 weeks, we can identify through this transabdominal ultrasonography. Here the beta HCG levels will be at the intrauterine gestational sac will be seen through this transabdominal ultrasound will be 1800 international units per liter. So this is the transabdominal ultrasound. As we had seen already in the question that what is the best initial test in order to identify this ectopic pregnancy means, that is mostly transabdominal ultrasound. And some more signs will be observed, that is Bagel sign and the blob sign. In case of Bagel sign, what can be observed? Here the hyperechoic ring will be observed at the head neck cell region. This is observed around the gestational sac. This hyperechoic ring will be observed around the gestational sac, that is Bagel sign. Whereas blob sign means the small mass, very small mass will be observed, and that too in conglomerate mass will be observed at the ovarian region, that is indicated as a blob sign. So here there is no observation, there is no evidence of any sac or embryo. Here we cannot identify any sac or the embryo, that is blob sign. So we had already seen in the explanation the different sites of implantation will be observed. Here mostly if the implantation is at the cervical region, that may be angular, cervical or any cesarean, like that the cervical will be, and the intrauterine will be most of the time the tubal site will be observed. Here in case of extrauterine also the tubal includes interstitial, the interstitial region which is connecting the uterine cavity and the fallopian tube, the interstitial region or isthmus region, ampullary part, the lengthy part in the fallopian tube, ampullary part or the infundibulum. In case of tubal pregnancy, the very low site will be, the less observed site will be interstitial, that is about 2%, and most of the time it may be seen in the ampullary part, that is about 70%. The whole tubal pregnancy covers about 96%. In that only 2% covers the interstitial region, whereas 70% covers the ampullary region, and interstitial will be like 18%, and isthmus will be around 25%. Sorry, I had mistakenly said that interstitial will be very less. Sorry, infundibulum will be very less, that is about 2%. And in case of abdominal, we will see that may be primary or secondary outside the uterine cavity, abdominal. In case of abdominal also, primary and secondary, and the secondary includes either intraperitoneally or extraperitoneally. Extraperitoneally means outside the peritoneum, that is about the pregnancy will be observed at the broad ligament region, that is extraperitoneal cavity. So these are all the sites of implantation which differs from person to person in case of this person affecting with the ectopic or the tubal pregnancy. The main management includes if the patient is based on this, if the patient is hemodynamically stable, the person may go for laparoscopy. That too, the ectopic pregnancy will be unruptured. Like if the rupturing may not takes place in this condition, the person may go through the laparoscopy. Here the expected management will be the person need to identify the situation and need to go for the immediate treatment and need to take complete bed rest. And coming to the medical or surgical management, in case of medical management, the person may go for the methotrexate injection. This methotrexate helps to identify and stop the growing cells. Whatever the cell growth was there, it helps to stop that cell growth, and the cells which are existing, which are identified, it can be dissolved easily through this medical management, that use of methotrexate. And the surgical management will be going for laparoscopic surgery. Then if the patient, this is all identified if the patient is hemodynamically stable. But if the ectopic pregnancy got ruptured itself in the tubal, the bleeding may be happened. So if the patient went into shock, immediately they need to go for resuscitation and laparotomy may be identified. This ectopic or tubal pregnancy, if it is not treated properly or early, it may lead to life-threatening complication. So if the person had gone for resuscitation and the laparotomy in case of ruptured ectopic pregnancy, most of the time salpingectomy may be the best indication for this, because as the fallopian tube is involved in ectopic pregnancy, if once it is observed, later also the frequent times the pregnancy may develop in the fallopian tube. So salpingectomy is indicated in case of this ruptured ectopic pregnancy. Thus we will see through the small video how this ectopic pregnancy will be happened. So the ectopic pregnancy, the fertilized egg will be outside the uterine cavity. Normally the egg is fertilized in the fallopian tube. Here the sperm meets the egg during the conception, and the ovum, whatever releases, it travels through the tube and reaches the uterine cavity and implants over here in the uterine cavity. Normally this is the process, but in case of this ectopic pregnancy, what happens? This fertilized egg reaches the fallopian tube and it stops there. So outside the uterine cavity somewhere it is implanted. So most of the time it may be observed in the ovary, peritoneal cavity or the cervical region. Excessively we can observe most of the time in the fallopian tube only. So as it indicates, it got observed in the fallopian tube, it is also called as tubal pregnancy. Once if the embryo got implanted over in this tube, it stops there and begins to develop, and growth will be seen over here. So as it grows further, it may cause rupture, because this tube may not stretch or strain. And if the pregnancy test was done, it shows the positive pregnancy because there will be the rise in beta HCG levels, right? And some of the symptoms in case of this ectopic pregnancy will be vaginal bleeding. We had already seen in the classical triad, like vaginal bleeding will be scanty dark brown in color. And pain also we had seen in the classical triad that the pain will be differed in the nature and the severity, and most of the pain will be observed in the lower abdomen, pelvis and the lower back. Along with this dizziness and the weakness, shoulder pain and the rectal pressure will be observed in this situation. So all these manifestations, all these symptoms will be observed. Most of the time uh, this ectopic pregnancy will be identified in the early trimester itself. Only during the first trimester itself we can identify this condition. If it is not identified early, it may lead to life threatening complications, very serious complications. It leads to life threatening. Sometimes the person may enter into septic shock and death. Here the fallopian tube can be burst because it is starts growing in the fallopian tube internally, because it doesn't have the capacity to stretch or strain. So as this further grows in the fallopian tubes itself, if it is not treated properly, it is going to burst and causes the internal bleeding. The bleeding will be observed as it burst inside the fallopian tube, and the bleeding will be released. So this is all about the today's session. If you are having any queries, kindly let me know in the comment box. Thank you.